I don't know any ears, nose, and throat doctors that are doing anything that Dr. Dennis is doing. So when we were able to research his work and see some of the stuff he's done, it's really mind-boggling.
Yeah.
And it's such important work. I can't even explain.
Yeah. So, Dr. Dennis, we'd love for you to tell us. I know that you've worked on tens of thousands of patients, and you obviously didn't just start yesterday. You have a lot of what I call experience, education, and empathy, which are the 3 E's that I suggest that people look for in a doctor and a trained medical expert that can really support them. You care so much about your patients, and you do the digging, you do the research, and that's why you've had so much success with so many patients. So, let's start with that. Like, what makes you so credentialed that people should listen to you? We know why, but we love for the listeners to hear why.
Well, I took ENT training at Johns Hopkins Hospital, which was the first institution that taught ear, nose, and throat as a specialty.
Mm.
And at that time, it was 1980, and was 76 before that. So when you're at Johns Hopkins, you have a subspecialty in each area of ear, nose, and throat, and you spend time with those professors, and they teach you how to do the surgeries on each item that you're going to have to do. And then the last year, they let you go anywhere in the world you want to go to do 3 different tutelages, which would be whatever you picked. So I did that, and then came back and practiced. And when you go in training, you're there in each thing for about a month. And then you think, well, what you learn gets everyone well. And so when you get into practice, you start treating people like you were taught. And then you notice that some of these people aren't getting better, no matter what you do. And so we had patients that had chronic sinusitis, and they were on antibiotics, steroids, surgeries, you name it, we did it, and they weren't getting any better. So I started asking myself, why is this? So we got a patient that had been coming for several years, and he always had pus in his nose, no matter what you did. You name it, we did it. It didn't work. So he came back one day, and he was totally clear. I'd never seen him clear before. So I asked him, what have you been doing? And he said, well, I went to the beach for 2 weeks. And so then I knew it was environmental, and then we figured out it was mold. And then from then on, it was kind of a drag race trying to figure out how to treat it all. So that's how it all started.